And we have a question from a young person who wanted to know if it was bad to crack her knuckles. She said her mother kept yelling at her to stop, and she wanted to know what I thought. Well, I thought I would ask the best expert I know, Dr. Robert Marcuson, hand surgeon from San Francisco. He's a clinical professor of surgery at the University of California, San Francisco, and has 40 years experience in the hand. So welcome back to the show, Dr. Marcuson. Is it okay to crack your knuckles? What do you think about that?
Oh, give me a little background. How old is this person?
16.
All right. Does she have long, lithe fingers and long joints? And is she somebody who can show off in the schoolyard how she can touch her thumb to her forearm? What?
She's pretty tall. Maybe will be 6 foot or near there one day. I didn't observe. I was just looking at the cracking. I wasn't observing too much the range of motion.
Well, you see, first of all, there's no physiologic reason. There's no health reason to crack your knuckles. Question whether it's obsessive behavior and because it's not really going to help you. But it's not just the knuckle, because when you crack a knuckle, you're forcing these ligaments on either side, collateral ligaments, to stretch, because the profile of the head of the metacarpal is a trapezoid, okay? And so as you go like that, you're kind of forcing those ligaments, and you could get a little inflammation there. You're also forcing tendons that may not want to be forced, because the extensor tendons are really just there to position you for sudden movement. They're not infinitely warranted against any and all strain. So the worry would be adjacent inflammation. The joint capsule, its ligamentous supporting structure, the overlying straightener extensor tendon, the contributors to nuance level motion, which are lumbricals, Latin for worm. Muscle worms its way along there and gives
Love
you the...
that name. Love the Latin names.
There
Love
you go. The interosseous muscle, palmar interossei bring you together, dorsal interossei spread you. And so it's really a concert of activity going over that knuckle. And why would you disturb it? You become sort of the bull in the anatomical china shop. And you really don't need to do that. My recommendation, and especially if you have cold hands, which are generally low oxygen saturated hands, hypoxic hands, you're gonna, if you develop inflammation, it'll be very slow to resolve, because blood flow per unit tissue, meaning inflow, outflow, microcirculation, matter greatly.
So one thing I suggested to this young person was that she do tendon glides if she needed something to do with her hands, and she liked them. Tendon glides are considered to be as important as cardiovascular exercise for the hand, according to one study that I read. What do you think about that? Because my feeling is if someone needs a nervous habit, you need to give them something else to do. What do you think?
Okay, here you go.
Oh, okay. Magic.
Chinese balls, Bao Ding balls.
Excellent.
Don't doubt the wisdom of the ancients. What are we doing? We're balancing large muscles in the forearm with small muscles in the hand, and we're having something to do, and it can even be musical.
Ah, I hear the music.
And so you get small ones, perhaps pong ball or golf ball size. They don't have to be large. Get 2 sets of them, and you're better than Humphrey Bogart, Cane Mutiny in the fog on the boat.
Hold those up so we can see. Hold it up a little bit. Good. Okay.
If anything, as a busy surgeon, I pride myself in cultivated and maintained ambidexterity. I'm no good in training a left-handed surgeon if I'm relentlessly right-handed myself. I have to be able to switch equally between hands. And arguably, that's one of your best insurance policies, to be able to switch equally between dexterous hands.
So you can operate with your left hand. You've trained your left hand to use
Constantly.
Wow, I'm impressed.
Well, it's not me showing off. It's me getting through a day efficiently without tissues drying out.
Wow. Well, that's another conversation. Thank you for answering the Ask DQ question. I will pass this along to all the viewers who will benefit from this knowledge. Thanks for coming onto the show. Thank you
Always
all for
fun.
watching, and please subscribe.
Thank you, Deb.